these are big ticket, heavy hitting issues that you just raise. And I think it's so important that the average person, listens and understands like what they are against and how it's affecting their household and their livelihood and their health ultimately.
Yep.
Because
exactly.
Yeah, because it's very discouraging to know that, if I have a major health issue and I'm on Medicare and I have to pay such a large percentage of my copayment, as you describe. And
now, the solution for that has always been that you can buy what's called a private Medicare supplemental policy to help you with those out-of-pocket costs and so forth that traditional Medicare has. And there's, 10 or 12 different standardized plans that the federal government has set up. They're sold by private insurers. They're not particularly cheap. And so how do we make them also simpler and more affordable?
Yeah.
And then there's this private Medicare option, in my opinion, grossly misnamed Medicare Advantage, because the only entity to whom this program is advantageous is the insurance industry, in my opinion. And it was created and set up for them to be able to cherry pick the Medicare market and make money off the Medicare market as opposed to whatever the needs of patients are. But nonetheless, there is that option available. So that's another thing. And about half of people on Medicare are in the private Medicare program. You buy a plan from a private insurance, it's supposed to offer you all the same Medicare benefits, but it has all the downsides of private insurance with it, limited networks, having to jump through all kinds of hoops, denials of coverage, pre-authorization requirements, etc. And they've rigged the system in Congress over the years such that the insurance industry is making a nice buck off of taxpayers through this program. So there's a lot of stuff to be addressed around that too.
Yeah, I mean, that's another thing that's consistent in that I'm hearing in the interviews, that these advantage plans, if you will, are really disadvantage plans, And
what's really interesting is I think there's a bunch of seniors, people on Medicare now, that are waking up and realizing that there's a real problem with the private Medicare program that needs to be addressed. There have been hearings in both the House and Senate on it, and members of Congress from both sides of the political aisle are waking up. There's a problem here that needs to be addressed. They've castigated the industry. They put out reports. So that's also another thing that's going to much more come to the fore than the next Congress and the next president. Like, okay, what do we do about this program?
As I'm listening to you, and clearly the policy issues circulates around, partly the legalities around it, the regulations around it, partly finance and the influence these big corporations have and decision makers around that affects the lives of so many millions of people. And I wonder, as you talk about entering the sort of the agent community or elder community, what kind of preparations you think you can, or advice you think you can give people from sort of the different economic strata, right? So those who are, I know you referred to a couple of websites, Medicare Interactive. I think that this is really, really wonderful. I guess my question is, do you see how does it affect poor, middle class, or affluent, or does it affect us across the board equally?
Well, it does affect everybody, but what you need is somebody on your side working with you, because it's daunting to try to sort it all out by yourself. If you're relatively healthy and don't have a lot of needs for complicated, ongoing health care, knock wood, you're kind of okay. You probably still need someone working with you at least once a year when you do your annual open enrollment decision making, which happens in the late fall.
Okay.
So that's one thing. So you need to find somebody who's working with you, who's on your side as opposed to on the industry side. So, that's important. If you're more affluent, you can usually afford perhaps the services of some kind of a financial advice or counselor. And they'll know this stuff. Then for others of us that don't have those kinds of resources available, we have to fall back on the nonprofit organizations that are around to help us. Also here in New York City, we have the Department for the Aging and New York City government, and for folks in other places, your local city government or county government or whatever, or senior citizen centers, they'll have social workers on staff, etc. So just reach out for help. Make sure you understand things. Be careful not to be bamboozled by somebody who may be trying to sell you something that sounds too good to be true, because in most cases it will be too good to be true. And
right.
You'll end up on the short end of the stick, ask a lot of questions. So but I would say for most people, don't try to sort all this out on your own. You really need somebody working with you. If sometimes just no other reason to explain these kind of bureaucratic terms that sound like gobbledygook.
Yeah.
They have a certain logic and meaning within the bureaucracy world for people who operate in there. But the average person, you won't have any idea what this means. And again, that sort of gets back to a point I was making earlier of the system is structured around those to meet the needs and whatever of the people who are within the system, as opposed to the actual patient and person who needs help. And it's not easy.
Yeah, I mean, this is absolutely terrific because as you're talking to me, I'm recalling that those who I've helped or have been in contact with who are either entering or applying for Medicare or Medicaid and are over 65 and they're faced with sort of deciding which Advantage plan they should choose, and what if you decide that you want to switch an Advantage plan from one to the other? What are the advantages within those plans and the differences? And how do we become educated and informed of all these different? I feel like they almost like sharks, that are.
Well, they are. But, if you don't want to go the private Medicare Advantage plan route, how do you make the traditional Medicare option work? Because that is there. Medicare Advantage is just an option for you. It's not,
right.
But you don't have to go that route if you don't want to, but it's more challenging. Well, there are challenges either way, but sort of how do you compare and contrast them? And when you first enroll, but then every year at open enrollment, you have a decision, what do you want to do?
Mm-hmm.
Which route do you want to go? And then within each route, how do you sort out the different options or decisions there? And as people get older and they may develop some cognitive impairments, be they mild to very complicated, how do you navigate that? I mean, in those situations, you absolutely need somebody working with you and on your side who's looking out for your best interests and not anyone else's.
Right.
Yeah, that's a real challenge. And so this is kind of what I often want to say to policymakers, you sit down and you design these things, and you are somebody who is probably younger, healthier, you've probably got an advanced degree. You know this kind of stuff. So but the vast majority of people are not like you. And so you have to be thinking the average person probably has a high school diploma, maybe a bit of vocational or collegiate training. And how do you design a system that they will understand and be able to use? So therefore, you have to keep the design of the system simple to use and operate. You have to keep the language and concepts behind it simple. As I was saying at the beginning, if I could scream anything, simple, simple, simple.
Yes.
Keep it simple. And that may mean that some of the systemic players, the other stakeholders, are going to have to adjust things and do things differently. And it may not work out to their best advantage that way. But we have to center the patient at the middle of this whole thing and build a system that works for them. And if that makes it more complicated for you, the stakeholder, then it's your job to figure that out on the back end for yourself and not thrust all of this complexity onto the patient, because it just doesn't work. And it becomes a barrier so that people don't get access to the services and so forth that they need in a way that's affordable. And that's what I can say.
I think you're spot on, and it doesn't only apply to this, the focus of the podcast, obviously, in our discussion is the elderly, but.
Oh, for sure, yeah. This is across the board for all patients, but particularly for older people, because they do rely on and need and use the healthcare system a lot more than the average person because they're older.
Yes.
It's not rocket science here. And yeah.
No, that's a great point. And over again, you hear, you see that they're just in the dark and they are making decisions just by sometimes guessing and don't know who, don't have. I feel as though sometimes they really need like hand holding and someone to sort of explain things to them and break it down to them in very simple form. And it's a medical issue. It's a legal issue. It's a financial issue as well. So it's not just one dimensional where you just say, okay, well, this is what we do and forget about everything else, because it affects the entire life, especially if you have a limited income.
Oh, absolutely.
Yeah, as you talk.
And then there are cultural things too, like people come from different subcultures in our society and have different experiences and thoughts about the healthcare system. And so it's important that those factors be taken into consideration too. It's not a one-size-fits-all thing.
So I'm getting the sense where it needs to be sort of this sort of scalable, right? Like, some of these services needs to be scalable, where we're looking at subcultures and their needs, perception, information, education, values. Yeah,
exactly.
Access to resources
that may exist in different communities around disability or mental health or a variety of things. Yeah.
Well, any last minute thought or comments or suggestions? I mean, you added so much to our discussion and to the listeners. I mean, I learned a lot just by talking to you. Anything else that you can think of that you can sort of leave us with?
Well, I guess I'm hearkening back to a phrase that came out of the 60s activist movement. I was an up-and-coming child / youth at that time, into the 70s. It was like, the personal is political. You can't take any of this for granted, to sort of walk away and sort of say, throw up your hands. I completely understand the impulse of that, but at the same time, you have to engage with the political system on this. You have to kind of, as best you can, keep yourself informed, engage with the lawmakers that represent you, hold them accountable. The most important thing you can do with those folks is to always start with sharing your own story before you get to any of the kind of more policy-specific conversation or any statistics or like, because your own personal story and experience is what grounds the conversation in reality. So lead with that, lead with your values, lead with your own personal experiences, and go from there. And don't disengage, engage, because otherwise the policymakers and lawmakers are only hearing from the stakeholder special interests, and they're looking out, quite logically, for their own, almost in many cases, bottom line, as well as their own institutional needs. And if your voice is not there at the table and part of that conversation, the lawmakers are going to make a very different decision than what needs to be happening. So it's really important that people, I know the cynicism around being politically active and engaged, but the sort of phrase is, if you're not at the table, you're on the menu. And so you've got to be involved in this as best you can.
Thank you. Thank you. This is terrific. Yeah, so the take-home message is that elders need to put their voice out there and people need to hear them.
Yeah.
Wonderful, wonderful.